Greetings, this is Dr. Douglas Maurer from iMedical Apps with another medical app review. Today we're taking a look at the latest app from the American College of Cardiology. This app is called TreatHF for Treat Heart Failure. The app is specifically for heart failure with reduced ejection fraction as opposed to heart failure with preserved ejection fraction, noting that the older terms systolic and diastolic heart failure are no longer used. There's a terms of service, a little bit about the app up front, which you can do not show that to me again potentially. It does have some brief directions there. We'll just cross it out for now. Essentially, it asks for information about a specific patient. We had a case that we discussed in the online version of this review. So it asks for some information up front. You can reset it to kind of start fresh. If you're not sure what the New York Heart Association classifications are, they have those there for you. We'll say our patient is a New York Class 2, and his ejection fraction initially we said was around 38%. It then asks what types of medications the patient is already on. We said he was on an ACE inhibitor, and specifically was on lisinopril. We'll say the patient does, if you're not sure about the contraindications to an ANRI, they're here for you. So Sacubitril specifically is the one that's FDA approved. So we'll say no contraindications and that he is tolerating and stable on the ACE. If you're not sure what that would be, it kind of tells you it's just your judgment. I think we stated the patient was not on a beta blocker, so we'll say none. And that he was taking Lasix. And we'll hit continue. The app asks a few other bits of information. In this case, we'll say the patient does have normal renal function. He is elderly. We'll leave the rest of that okay. Then we say view therapy advice. You have the ability here to print this out, to email the result, and then it discusses that yes, indeed, he is on an ACE, which is a good idea. You can consider potentially changing him over to an ARNI. It mentions the patient should be on a beta blocker, talks about diuretic use. Again, here's information about the ARNI, dosing information. Patient also meets classification to be on an aldosterone antagonist such as spironolactone. If again you want more information, you just hit more instructions, and then it takes you to the specific region of the app, which has all the treatment information. You can look at information on initiation, titration, and monitoring, all built right within the app. There's this entire section just on therapies, which is pretty impressive. It has these overall guiding principles for treatment, which again you can expand. It just talks about ideally you should use the target doses from clinical trials, which it outlines in the app. Talks about certain patients, such here as the, again, black patients benefiting from the combination of hydralazine and isosorbide versus optimizing team-based care, etc. Again, going back to all therapies. You name a therapy, it's here, from drugs to cardiac resynchronization therapy, who qualifies, who doesn't, etc. So things I like about the app, it's free, it's easy to use. You can see you can quickly jump around these different resources here. It has that large therapy section, which you see here, which is extremely comprehensive, but as you also saw, this very nice resource section, both for clinicians as well as for patients. Granted, these are linked here. They're not built into the app, but they are easily available. So I think that's great. There is an Android version of this app as well. Some things I don't like about the app. This app is only focused on heart failure with reduced ejection fraction. As most of you know, we have an epidemic of heart failure with preserved ejection fraction, and this app does not address that at all. Potentially that's going to come in an app update or with a completely separate app, but currently not part of this one. The app's pretty clear that throughout a lot of the information on therapies, you can see the big asterisk right up top, is coming from ACC expert consensus, while other portions of the app clearly have data to back it up, as we have information, for example, on aldosterone antagonists and how they can reduce mortality within certain patient populations. And then finally, the app, at least when I was initially using it, kept crashing. After a phone reset, it seems to be working better. So I'm not sure if it just needed an update or what the issue was. So your mileage may vary with that. But that is my look at Treat Heart Failure from the American College of Cardiology. This is Dr. Douglas Maurer from iMedical Apps. Take care.